Welcome to USMLE World, where we ask, answer, and explain USMLE questions. Today, we're diving into Step 2, Obstetric and Gynecology, focusing on pregnancy. Let's get started with question number 1. For the following case, if uterine curettage is performed, which of the following microscopic findings would most likely be found in this patient? A. Atypical endometrial cells, disorganized glands, and multiple mitoses. B. Dilated, coiled endometrial glands and edematous stroma. C. Inflammatory infiltration of endometrial glands. D. Straight, short endometrial glands and compact stroma. The case scenario is: a 28-year-old woman comes to the office due to vaginal spotting. The patient normally has regular monthly menses with 3 to 4 days of moderate bleeding. However, she has had spotting for the past 2 days, and her last menstrual period was 6 weeks ago. Vital signs are normal. Serum quantitative β-hCG level is 800 international unit per milliliter, with normal value at 6 weeks gestation is in the range of 1080 to 56,500 international unit per milliliter, and a repeat level performed 2 days later shows an abnormal rise to 900 international unit per milliliter. Pelvic ultrasound reveals no gestational sac in the uterus. The question is: if uterine curettage is performed, which of the following microscopic findings would most likely be found in this patient? Your options are: A. Atypical endometrial cells, disorganized glands, and multiple mitoses. B. Dilated, coiled endometrial glands and edematous stroma. C. Inflammatory infiltration of endometrial glands. D. Straight, short endometrial glands and compact stroma. You have 15 seconds to type your answer in the comment box. Congratulations if your answer is B, which is dilated, coiled endometrial glands and edematous stroma. This question is designed with the focus to assess your ability to conduct laboratory and diagnostic studies. This patient with vaginal bleeding, positive β-hCG, and no visible intrauterine gestational sac has a pregnancy of unknown location, which is concerning for an ectopic pregnancy, which has embryo implantation in an extrauterine location such as the fallopian tube. Early ectopic pregnancy may not be visible on ultrasound, therefore, patients require serial β-hCG measurements for diagnosis. This patient has an abnormally low β-hCG level for gestational age, which is 800 international unit per milliliter at 6 weeks gestation, plus an inappropriate rise in β-hCG level. In normal pregnancies, these levels double approximately every 48 hours. In cases of spontaneous abortion, levels typically decrease. Therefore, the most likely cause of this patient's low β-hCG level is ectopic pregnancy. Risk factors include pelvic inflammatory disease and prior pelvic surgery. Despite its extrauterine location, an ectopic pregnancy changes the uterine endometrium due to the secretion of β-hCG, which signals the ovarian corpus luteum to continue progesterone production. Progesterone promotes endometrial remodeling and decidualization, which normally optimizes the intrauterine environment for pregnancy. Therefore, if uterine curettage is performed on this patient, it would likely show dilated, coiled endometrial glands and vascularized, edematous stroma, also known as decidualization, but no products of conception, like villi. If you choose any option other than B, you are wrong. Let's briefly discuss the other options. Choice A cannot be the answer because atypical endometrial cells with disorganized glands and multiple mitoses are consistent with endometrial adenocarcinoma, a uterine malignancy that usually presents with vaginal bleeding. However, it typically affects postmenopausal women and is not associated with positive β-hCG levels. Choice C cannot be the answer because inflammatory infiltration of endometrial glands suggests endometritis, an infection of the uterine decidua. Endometritis is not associated with abnormal β-hCG levels. Choice D cannot be the answer because straight, short endometrial glands with compact stroma are found in the early proliferative phase of the menstrual cycle, which is 4 to 7 days following menses, prior to ovulation. Your take-home message from this question is that ectopic pregnancy should be suspected in patients with a pregnancy of unknown location, with no visible intrauterine gestation, and abnormally rising β-hCG levels. Despite their extrauterine location, ectopic pregnancies promote endometrial decidualization, which appears as dilated, coiled endometrial glands and vascularized, edematous stroma. Did you get the answer? Only click above to move on to the next question if you have the answer correct. If, however, you are unable to accurately answer, you must watch this episode once more. Recall that comprehension is essential for advancement. Unlock the secret to acing your medical exams, especially the USMLE, with our top-notch resources. Ensure you and your friends are well prepared by hitting that like button, sharing this wealth of knowledge, and subscribing to our channel. Remember, your success is just a click away.